In today's world, the health and wellness market is saturated with conflicting and often overwhelming information about supplements. For seniors, this can feel like navigating a minefield. Many end up taking supplements that do more harm than good, interfering with medications, depleting vital nutrients, or even triggering serious health problems. The truth is, just because a supplement is popular doesn't mean it's safe, especially as the body changes with age. In this comprehensive guide, we'll break down the facts clearly and simply. You will discover 4 supplements that seniors must absolutely avoid because they can silently wreak havoc on your body, and 4 powerful supplements that can genuinely support your health, energy, and longevity. Whether you live with a chronic condition or are simply seeking to age more gracefully, this information is for you. 1. Calcium supplements, strengthening bones. While straining the heart, calcium is an essential mineral for strong bones and teeth, and many doctors recommend calcium supplements to prevent osteoporosis and fractures in older adults, particularly post-menopausal women. While this seems like a sensible approach, mounting scientific evidence suggests a different story. Impact on cardiovascular health. Numerous studies have linked calcium supplements to an increased risk of heart attacks, strokes, and kidney stones. A major study published in the British Medical Journal found that people who took calcium supplements had a 30% higher risk of heart attack compared to those who didn't. This risk was specifically tied to calcium in pill form, not from food. Another study in JAMA Internal Medicine showed that men taking more than 1,000 milligrams of calcium daily from supplements had a significantly higher risk of dying from heart disease. Mineral interactions. High doses of calcium supplements can also interfere with the absorption of other crucial minerals like magnesium, zinc, and iron. This can lead to deficiencies that cause muscle cramps, irregular heartbeats, or anemia. The safer solution. The best way to get calcium is from food. Dark leafy greens, kale, collard greens, almonds, sesame seeds, canned sardines with bones, and fortified plant-based milks provide calcium in its natural form, along with cofactors your body needs for proper absorption and utilization. 2. Folic acid, a synthetic form with hidden risks. Folic acid is the synthetic form of vitamin B9 and is commonly added to multivitamins and fortified foods. While it's crucial for specific groups like pregnant women, its effects on seniors can be problematic. Metabolic inefficiency. The body needs to convert folic acid into its active form, L-methylfolate. As we age, this conversion process becomes less efficient. A significant portion of the population, up to 40 to 60%, also carries a common MTHFR gene mutation, which further impairs this conversion. Harmful buildup. When folic acid isn't converted efficiently, it builds up in the bloodstream as unmetabolized folic acid. This buildup has been linked to cognitive decline, weakened immune function, and even an increased risk of certain cancers. A study in the American Journal of Clinical Nutrition found that high levels of unmetabolized folic acid in seniors were associated with faster cognitive decline, especially when combined with low vitamin B12 levels. Masking B12 deficiency. Folic acid can also mask the symptoms of a vitamin B12 deficiency, which is common among older adults. By hiding the signs of B12 deficiency-related anemia, it can delay diagnosis and lead to permanent nerve damage. It's much safer for seniors to consume natural folate from foods like leafy greens and beans, or to use a supplement with the active form methylfolate under a doctor's guidance. 3. Iron supplements, a mineral that can accumulate and cause damage. Iron plays a vital role in carrying oxygen in the blood, and while iron deficiency anemia is a concern for some, most seniors, especially men and postmenopausal women, do not need iron supplements and can be harmed by them. Oxidative stress. The body has no efficient way to excrete excess iron. When you take more than you need, The iron accumulates in your tissues and organs, particularly the liver, heart, and brain. This accumulation leads to a process called oxidative stress, which causes chronic inflammation and cellular damage. Linked to chronic diseases. Oxidative stress from excess iron has been linked to a wide range of conditions, including heart disease, liver disease, Alzheimer's, Parkinson's, and certain cancers. A study in the Journal of Gerontology found that high iron levels in older adults were associated with increased cognitive decline and a greater risk of neurodegenerative diseases. When to take it? Iron supplements should only be taken when a doctor has confirmed an iron deficiency through blood tests. Unnecessary supplementation is a serious risk. 4. Magnesium oxide. Poor absorption and digestive distress. Magnesium is an essential mineral for muscle function, sleep, blood pressure regulation, and more. While many seniors turn to magnesium supplements for conditions like muscle cramps or anxiety, they often choose the wrong type. The most widely sold and cheapest form, magnesium oxide, is one of the worst choices. Extremely low absorption. Studies show that only about 4% of the magnesium in magnesium oxide is actually absorbed by the body. This means you are essentially wasting your money and not addressing a potential deficiency. Strong laxative effect. Because it is so poorly absorbed, magnesium oxide pulls water into the intestines, acting as a powerful laxative. While this might seem helpful for occasional constipation, daily use can lead to diarrhea, dehydration, and electrolyte imbalances, causing more harm than good for many seniors. Remember, this information is for educational purposes only. Always consult your healthcare provider before starting any new supplement, especially if you are on medications or managing a chronic condition. 1. Vitamin D3 with K2, the bone and heart protector. Duovitamin D3 is one of the most common deficiencies in older adults as the skin becomes less efficient at producing it from sunlight. Low levels are linked to weak bones, frequent infections, fatigue, and even cognitive decline. The crucial partnership. Taking vitamin D3 alone, especially in high doses, can be risky. Vitamin D3 increases calcium absorption, but without enough vitamin K2 to direct that calcium, it can end up in the wrong places, like your arteries, kidneys, and joints. This can lead to arterial calcification and kidney stones. Get tested. First, before supplementing, have your vitamin D levels tested, 25-hydroxy vitamin D. If your levels are low, which is common, your doctor may recommend a therapeutic dose of D3 paired with K2 to safely guide calcium into your bones. 2. Magnesium. Glycinate. High absorption and calming effects. Magnesium glycinate is a superior form of magnesium. It is created by binding magnesium to the amino acid glycine, making it highly bioavailable and gentle on the stomach. No laxative side effects. Unlike magnesium oxide, magnesium glycinate is well tolerated, even at higher doses, and does not cause a laxative effect. Added benefits. Glycine itself has calming properties, making this form particularly beneficial for those struggling with sleep problems, stress, anxiety, or muscle tension. Research shows it can significantly improve sleep quality in older adults with insomnia. 3. Vitamin B12. The key to brain and nerve health. Vitamin B12 is a nutrient that doesn't get enough attention, but is critical for seniors. It plays a central role in energy production, nerve function, and brain health. B12 deficiency can mimic symptoms of dementia, such as memory loss, confusion, and brain fog. Why deficiency is common. As we age, our ability to absorb B12 from food decreases significantly due to a decline in stomach acid and a protein called intrinsic factor. Medications like metformin and acid blockers can also interfere with its absorption. The right form. For seniors with absorption issues, oral or sublingual under the tongue, supplements of methylcobalamin are often recommended. A daily dose of 500 micrograms to 1,000 micrograms is common. but your healthcare provider should determine the right dosage based on your needs. 4. Omega-3 fatty acids, EPA and DHA. Powerful anti-inflammatory agents. When it comes to protecting your heart, brain, joints, and overall longevity, few nutrients are as powerful or well-researched as omega-3 fatty acids. These essential fats fight the chronic inflammation that underlies many age-related diseases. Combating chronic inflammation. Omega-3s help reduce inflammation, improve blood flow, lower triglycerides, and support joint mobility and brain function. They are crucial for protecting against heart disease, Alzheimer's, and arthritis. Best sources. The best way to get omega-3s is from wild-caught fatty fish, like salmon, sardines, mackerel, and herring. If this isn't possible, a high-quality fish oil supplement can be a great alternative. Most health organizations recommend consuming at least 2 servings of fatty fish per week, or taking a daily supplement with around 1,000 milligrams of combined EPA and DHA. Supplements can be powerful tools for health, but only when used wisely. Remember that they are meant to complement a healthy lifestyle, not replace it. Prioritizing a balanced diet, regular exercise, and good sleep will always be the most effective strategy for healthy aging. Always talk to your healthcare provider before making any changes to your supplement routine.